Hi, my name's Carol Speaker, and today we'll be doing pelvic girdle stabilization. My client here is Leah. This is her first time receiving treatment, so you'll be experiencing a real-world event of explaining exactly what she needs to do. So I'll have you scoot all the way towards me, and we want her very close to the edge of the table. No bolster. And go ahead and bring your knee up. And you'll want to first explain to your client that you're going to have her slowly bring her knee down and then off the side of the table and really reach for the floor. Okay? Go on up. And so now we're working the iliopsoas. I'm going to palpate the pelvic bone. So right here. And then once you find the pelvic bone, you're going to scooch right medially of it, and you'll feel the psoas right in there. Sometimes it's bulging. Hers is a little bit. So what I like to use is a stone like this, but you can use your fingers. The stone just makes it a little more comfortable for the client. So start right on top of the bone and slide off of it. So you're on the muscle. Slide down the muscle. And then go ahead and lower your leg, Leah. And really reach for the floor. So you can see that the stone is pinning the muscle down as she lowers her leg to the floor. She's getting a nice stretch in there. Okay, go ahead and bring your knee back up. This can be a pretty painful experience for the client, so you want to warn them that it's going to be a radiating, burning sensation sometimes. It isn't always, but okay, so we've done that. And then I'll have you stay right there. And actually, I need to keep her foot uncovered. So now we're going to work the groin muscles where all the adductors come in and originate, and the quads as well. So what I like to do is just palpate the tight muscles right at the bone. She's got a tight one that goes right in here, and you can feel the bone right there. So right at the bone, you want to pin that down. Okay, go ahead and lower your leg to the floor like you did before. And just keep the pressure right where that muscle inserts. And now bring it on up. Leah doesn't happen to need it, but for some people, it'll just have an overall general tightness. So what you'll want to do is use your forearm. This is not comfortable for the client, so you have some empathy for them here. And I pin the muscles down right in the valley, right here, where there's the bone here and the muscles meet. So I'm right in there. And I'm putting the pressure towards the bone, but I'm not putting a lot of pressure on the bone because it hurts a lot. So go ahead and lower your leg again and go as slow as you need to. For Leah, this is probably just feeling like a good stretch. Sometimes it's extremely painful. So whenever you're ready, you can bring your leg back up. Okay. And now I'm going to work the quads. And I still am not using a bolster because I am palpating for tightness here. Because of time, usually I do this within an hour, so there isn't a lot of time to really work everything with all the emphasis we like. So what I'm doing is I'm palpating the tight muscles, and I'm just kind of giving them a little bit of a linear pressure here. And because I've released them at the insertion point, or origin point, they they really won't be too bad. So I just kind of give them a massage here. Feel the tightness. If there's anything really tight, I'll work it out. But if it's just kind of an overall tight, then I'll just do this for a couple of minutes and then leave it alone. And then next time I see her, I'll look at these and see how they're doing. Okay. That's already loosening up quite a bit. So what I'm doing here is I'm not balling my fists up. I'm not giving her as much pressure as I possibly can. What I call this is the springboard. So my hands are loose and my fingers are not stiff. Nothing is stiff about what I'm doing. I'm literally just putting enough pressure for my hands to kind of stop right there. So you want this to be springy and loose. And it should be able to move around with the tight muscles underneath the skin. And make sure your thumbs are loose. Make sure, also I want to note how I'm standing. So I'm standing in a lunging position where my weight is on this leg. This leg is out back and straight, and it's straight along with my back. So that way I'm not slouching. The legs are taking most of the brunt of the work. My back really is not. And you don't want to be tilting your head to one way or another. You want it straight. And you want to loosen your shoulders. So don't be doing this and don't be doing this. A lot of therapists do that. We want to loosen up our fingers, loosen up our shoulders. Keep everything nice and loose. And moving, rocking our legs. Anybody who does yoga should know this is the warrior pose. So do lots of that and you'll have it down. Okay, so stay right where you are, Leah. And I'm going to get some pillows. I like to use pillows. Some people like to use bolsters. This is the best way I've found. Nice, big, fat, fluffy pillows. So I'm taking the bottom sheet along with everything else. I'm folding it over Leah. I've got a fairly flat pillow on the bottom that I'm using here, and a big, fat, fluffy one on the top. Let's see, there we go. Now I'm going to bring everything back over. Okay, so now Leah, I'm going to have you hop on your left leg and bring your right leg over the pillows. There you go. Okay, and for her comfort, I'm going to give her a pillow. There you go. Now I'm going to work the IT band. Okay. So again, I want to make sure that you're lunging, legs straight, back straight, and your neck is straight. You're not tilting to one side or the other. The body mechanics are extremely important with this because you're going to wear yourself out if you don't have the proper body mechanics. This is a very grueling massage to give, and it can be to receive as well if the client's in a lot of pain. All right, so I've just oiled up her leg. I'm oiling up my forearm. I like to use canola oil for this because it allows me to use the correct speed. It's got the perfect viscosity for this type of work. Lotions absolutely don't work. So you can try it, but most people give up on that one. So I'm starting right at the bone. I'm kind of just starting on top of it and sliding off. I don't put any pressure on the bone. That would hurt. I'm just using it to find the insertion point. With a floppy wrist, you don't want to do this. Everybody wants to do that, including myself, and you might catch me doing that today. But the intention is to have your wrist be nice and floppy. I'm going to go pretty deep and really slow. So this is going to take a little while. You want to push into it until you feel it pushing back at you. This isn't a contest between you and the muscle, so I don't want you feeling like you should just push as hard as you possibly can. Just go until you feel a little bit of a ridge pushing back. And then the speed should be only fast enough for that ridge to be letting go and letting you in. I'm not using my elbow at all. It's just the forearm. I also like to do it at a little bit of an angle, right about here, because sometimes people will have an adhesion that comes down diagonally like this. If you go up the IT band at a diagonal, you'll go over that adhesion nicely without popping over it, which is really painful for the client. If you feel that the resistance is just not letting you move, you're on that adhesion. So what I do is I'll let off a little bit, and then you'll find that you'll just roll right over it, and then you can apply the pressure again. She so far does not have that adhesion, so that's good. Usually you find that adhesion for people with some pretty bad back problems. And Leah's fairly healthy, so she doesn't have a lot of pain going on. Okay, it tends to get more tender the higher up towards the bone you go. I want you to make sure that your elbow is under your shoulder as much as you can. So I'm bringing my body up with me. I'm not allowing my arm to go up. I'm bringing my whole torso up too, which means if you have to get on your tippy toes, that's what you got to do. So make this a complete stroke. I want all the way up to the bone, but ease up the pressure a little bit as you're getting on top of the bone. Okay, and I'm going all the way over it. And that's where I'm letting go with my pressure. And you'll see the ischemia right here. It's turning pink. This is where her issues are. Sometimes the pink will be down here. It's just wherever it was the tightest, the blood is rushing to that area to fix it. So you know that you did a good job if you see pink. So now we're going to do a hamstring stretch. So cover her leg up to her knee, straighten her leg, and then instruct her, Leah, to tell me when to stop, okay? So just walk backwards. What I'm doing is I'm cradling her knee with my hand like this, and then I've got my other hand on the calcaneal tendon. So just walk backwards. Once you feel it resist a little bit, then you want to go slow until she says that's good. And so now what I do is I do this for 15 seconds. If you don't have a clock with a second hand, then count to 15. I usually do 1,000, 2, 1,000. And that's about 15 seconds. So bring it on back. So Leah, this is your neutral position. She's going to be moving her leg all around, so she needs to know that this is where she needs to end up. So now we're going to work the glutes. And people with severe back problems, usually, this is what I find, on the right side, it tends to be really tight right in here, the whole lower side. So we'll do lots of active releases and pins and stretches to get that loosened up. So the greater trochanter is right about here. What I'm doing is I'm using this part of my arm, I do not have my elbow in her glutes ever. The whole time it's this flat part of my bone here. This is painful and it's more work for you than needs to be, and it's hard to keep your balance with this. So I've got one hand on the table. I've got my legs in my lunging position, and that way I can control how much pressure I use on the glutes. Wrist is relaxed. It's easiest for you to think of it like you're not pushing into the glutes, you're leaning. So that way you can do this all day long with very little effort. Also, you want to keep the elbow as close to under the shoulder as possible and stiffen up that shoulder so that you're not overstretching your own tendons and muscles. So stiffen it up, lock it into position, keep that elbow under the shoulder. And I just go in little circles around the greater trochanter to kind of loosen up that tightness in there. And I'm also feeling for what's going on. She definitely has tightness. And back to neutral. There we go. That loosened right up. So what I'm doing is I'm kind of going around like this. So I start at the greater trochanter, I'm going down to the sits bones area, on up around the sacrum, up to the TFL, and that's where I'll finish. So here I am right about the coccyx. A lot of people with back problems have a lot of tightness right at the coccyx. So I'm just starting at the coccyx with 0 pressure and just moving off of it until I feel a tight muscle. And then this is where I use a little bit more of the elbow to, if I need a fine pressure, a pinpointed pressure, I just apply that pressure right there. And now I'm going to have her raise her knee towards the ceiling. With your ankle as well. There you go. You need to fire all those muscles. Clients like to cheat as much as possible. You can't let them. And relax. There we go. And then that fully released. It doesn't always fully release. What we're looking for is a 25% release. That's all. It's all the muscle needs to get that circulation in to finish the job. So we're just opening up the floodgates for the real healing to happen. So don't waste too much time trying to get one spot to release. If it made any change whatsoever, move on. Okay, so now I'm on the sacrum. Sliding off the sacrum, I'm right on some tight insertion points here for glutes. Go ahead and raise your knee towards the ceiling. Hold. You got to really stay on this muscle. Sometimes it'll kick you right off, especially when you're working on a big guy or something. Okay, and relax. Okay. So now I'm up towards the TFL. And this is another area where people have a lot of tension. And so if you just pinpoint that origin point and pin it down, okay, raise your knee towards the ceiling again. And hold right there. Actually lower a little bit. You don't want them to pop you off. If you feel like you're not on the spot that you pinned, have them lower their leg a little bit and then you can stay on it. And relax. There. Okay, there's a spot. And sometimes this will reveal new spots too. So go ahead and just about an inch. There you go. Right there. And relax. Okay, that loosened up. All right, so now I'm on the TFL and I'm working my way down the greater trochanter. And now the muscles attached to the greater trochanter don't feel anything like they did when I started. They're all loose and they're going to let her skeletal system do what it's supposed to do. Okay, so we're done with the glutes. Now we're going to work the QL. So I'm going to have you straighten your leg over your other one like you're standing. There you go. So I remove the blanket to work the QL, but I leave the sheet. And I do this for everybody, even men, just because I like to use the friction of the sheet to kind of help grip the QL. So now what I'm doing is I'm using my thumb and fingers here to kind of massage it a little bit and feel where the tightness tends to be. There's 3 points I've noticed that are common. Right in the center, and then the ribs, right at the base of the bottom rib, there's a tight spot right there. And a lot of people will come in complaining of that spot. And then right at the top of the sacrum, right in here, there's a tight spot, and people will complain about that too. So there's 3 ways. There's, well, one way for each spot to release. What I like to do first, because sometimes this will work for every spot, and it'll save me time, is to get a good grip of that entire QL. And this takes a lot of hand strength, so this will take practice. But I just kind of grab it just like this. And I instruct the client to, when I tell you to, go ahead and bring your hip towards your ear like you're a belly dancer. And then when I tell you to bring your heel towards the wall, lower your hip and your whole entire leg, pointing your heel towards the wall and your toes towards your head. So there you go, just like that. Okay? All right, so now I'm going to grab the QL and I'm really squeezing it. And sometimes people will hike their hip up towards their ear a little too far and it'll pop you out, so you have to tell them to lower it a little bit. Okay, so I've got a good grip on this QL. Go ahead and bring your hip towards your ear, Leah. And hold right there. I hold this for 10 seconds. And relax. Okay, did a little release, so go ahead and bring your heel towards the wall. And I hold that for 10 seconds. And relax. There, it kind of melted with that one. Okay, so now under the, well, at the bottom of the ribs, right where that QL attaches, right in there, I'll use my thumb. I don't use my thumb like this. That's overextending. You're going to hurt yourself. I use the point of my thumb and I push straight down using the inertia of your whole arm. So straight down. And this does not feel good to a client, especially when they have pain here. So this is something they're going to have to breathe through. So be very empathetic when you apply that pressure. Don't just dig in. You want to apply it gradually. Okay, so go ahead and bring your hip towards your ear, Leah. And keep the pressure on. Count for 10 seconds. And relax. This one I do not have her point her heel towards the wall because it tends to tighten the QL back up. So you just want her to hike her hip towards your ear. And that really did a good job loosening that muscle up. Okay, so now I'll show you how to release the insertion point of the QL at the sacrum. So let me get back here. What you want to do is palpate the top of the sacrum, get your forearm in there, and now bring your heel towards the wall, lowering your hip, and really stay with it and push. And count to 10. And relax. Okay. That feels a lot better than it did when she first came in, or when I first started working it. There's a little tightness right in here that didn't get released. So I'm just going to put my thumb in it. Okay, go ahead and bring your hip towards your ear. And I'm only going to do that for 5 seconds and release. Okay, that did the trick. I wasn't on the kidney. You want to make sure, well, the kidneys are back here. I wasn't on an organ. You don't want to be, you want to like push into the muscle. So just make sure you're on muscle tissue. You can feel the difference. Okay, so now I'm going to have her bring her arm over her head. And now point your heel towards the wall. I'm just grabbing onto that sacrum and I'm pushing with all my weight. I'm going to have you take it, go ahead and relax your leg and just breathe nice and deep. This is an opportunity for you to get a good stretch. So I like to keep my feet flat on the floor and get a nice calf stretch out of it. I lower my head and get a nice stretch in the back of my neck. And I keep my whole body as straight as I possibly can. This is actually important for you to do, because after 5 of these in one day, you're going to be pretty tired. So you want to stretch out as much as possible. Okay, and relax. All right, so we're done with this side. So now I'm going to have Leah lay on her back. And then I'll take the pillows. And I just toss them, because I'll need them on that side. Okay, and take the pillow. And now I'll have you scoot all the way towards me. Okay, so now bring your knee up. We're going to do the psoas. So I'm palpating the pelvic bone. I'm going to grab my stone. First, I'm going to feel what's going on in there. She doesn't feel too bad on this side. The left side tends to be more tender than the right. Right at the edge of the bone, I'm scooching down the muscle. Okay. Go ahead and lower your leg, Leah. Then just slide up the muscle as she lowers her leg. This gives a great release on the muscle. Okay, bring your leg back up. And with your knee up. And then feel it. Hers happened to release, but if it didn't release, you can do it up to 2 more times. On the 3rd time, it should release. Usually they do. Okay, so now we'll do the groin stretches. All right, there's nothing tight on this side to really pinpoint. So otherwise I would be using my thumb to just push while she brought her leg down. But I'm just going to use my forearm. Whether they feel like they need it or not, use the forearm to pin the whole thing down and have her do a stretch, because sometimes it's tighter than it feels like it is. So this is going to take practice, so just practice, practice. All right, so I'm pinning the muscles down right close to the bone. Go ahead and lower your leg to the table. And bring it back up. Okay. And now we'll do the quads. All right. And again, I'm using the springboard fingers with relaxed thumbs in the lunging position, relaxed shoulders, straight head and neck. And I'm just massaging, just to bring some circulation to the area. Her quads are tight right close to the knee, so I'm going to give that a little extra attention. If the quads are still tight on the second treatment, that's when you'll want to give them more attention, but usually they'll just release on their own when you've done this little bit of massage on them, and then work everything around them, and then we'll give them a stretch later. Just make sure whatever you find that's tight, just kind of do a deep linear friction on it. There we go. Okay. So now I'm going to grab my pillows. Let me fold this over Leah. Okay. All right, so go ahead and hop on your right side, bringing your left leg over the pillows. And here's the pillow for your head. Now we'll work the IT band. Okay. So when I'm working the IT band, I make sure I'm lunging in a way that my hips are facing the client. So on this side, I'm doing my left leg is lunging, my right leg is back. And I'm got my hand on the table so I can control how much pressure I'm using with my right. With a relaxed wrist. Starting at the bone, I slide up the bone and off of it, and now I apply my pressure. Sometimes you'll feel it kind of quivering and sort of wiggling around in there. That's the muscle releasing. So that's a good thing. I think she just might have an adhesion right here. It's not letting me move, so I'm going to ease up a little bit. And go off that adhesion. There we go. Now I'm off of it, and this side's a little bit tighter than the other side, and that's common. Just make sure you stay over the elbow and that your shoulder is locked into place. You don't want to blow your shoulder out. And don't rush this. Okay, yeah, this side's definitely tighter than the other side. All right, she's got lots of ischemia all the way down to actually, it's all the way down to here. So this side is definitely not a happy camper, but after this, it will be. All right, so now we're going to do a hamstring stretch. Okay, so we want the leg perfectly straight. Cradle the knee under, or your hand under the knee, and the right hand behind the calcaneal tendon. Bring it up slowly and tell me when to stop, Leah. And right there. So now 15 seconds. All right, we're done. Okay, now we'll do the glutes. Okay, starting at the greater trochanter, start at the top of the bone, work my way medially. On this side, you can do what you want. I tend to go clockwise once again, just because it's easier for me. Also, the left side tends to be tighter up here rather than down here. Everybody's different, but that just seems to be the rule of thumb. So I just tend to go this way to get rid of the tightness up here before I work down here. But whatever works tuberosity. These are hot spots for tight muscles. They like to hide out here. So really feel around in these spots. I suggest feeling around a perfectly healthy person and then feel somebody who complains of back pain, and you'll feel the difference. You'll find these little spots. They're usually right around all the bones because that's where they insert or originate. Okay, so I've got it right at the ischial tuberosity, at the top of that anyway. So bring your knee towards your chest. We're going to do a pin and stretch and hold. And I'm really having to apply a lot of pressure to stay on this. But all I'm doing is leaning. I'm not using a lot of energy. I got my hand on the table. I'm leaning on the table as well. And then the rest of my weight is applied right at my elbow. Okay, back to neutral. And now I'm going to feel it, and it feels really bouncy now, which is what we want. Okay. All right, now I'm just going to do kind of a checkup on it. Check everything around. It all feels nice and healthy. All right, so go ahead and straighten your leg, Leah, and we'll work the QL. Yeah, she's tighter on this side than she was the other side. Okay, so now I'm going to really grab that QL and bring your hip towards your ear and hold. For 10 seconds. And heel towards the wall. Keep the pressure on. And now it's kind of melting, and so I'm having to squeeze a little more to keep the pressure on, because as it melts, the original pressure isn't going to be enough. And relax. And so I keep the pressure on as she relaxes, and I hold it for another couple seconds, and I kind of wriggle my way off of it, and I can feel it continue to melt under my pressure. And now it's completely released. I feel it. Yep, it's nice and soft now. That saves you a ton of time. You won't have to massage. So now I'm going to release the attachment point right at the bottom of the ribs. Okay. roll onto her stomach. All right, so now I have her prone, and we're gonna work the legs first with a bolster. So I've got the bolster under her ankles. We're gonna start off with some stretches, and I inform Leah to let me know when to stop. So I just tell Leah that I'm gonna do a few stretches with each one, tell me when to stop, okay? Now I'm doing adductor stretches. So I'm cradling her knee with my left hand. My right hand is cradling her ankle. My wrist is away from me. My fingers are pointing towards me. You don't want to do it like this. It's too much effort for you. This way is easier. Okay, so no helping. Relax and tell me when to stop. So just walk backwards slowly with this one. Okay. But you don't want to go too slow. I'm going to stretch her for 15 seconds. You don't want to go too slow. I've seen people inch their way backwards so slowly that they're going to waste the rest of their hour. So, all right, and now we're going to do a quad stretch, and I usually go right into it, but I'm going to explain it here to you. So I want to make sure that your hips are facing her in the table. You're not doing it this way, you're doing it this way. So you want to lift. You're already in this position from bringing her back from the adductor stretch. So you want to lift her leg up, bring this leg, the right leg in, but it won't always be your right leg because the other side's going to be the left leg. So bring the leg up that is opposite. Go ahead and let go. That's opposite of facing her. Okay, so my hips are facing her. That's important. Now I've got her on my leg, and go ahead and tell me when to stop, Leah. Okay. Some people, I can bring it all the way to the glutes and they're not going to feel a stretch. So when that happens, I'll scoot my leg up a little bit here. And then I grab their knee with my forearm. Don't try to do it with your hand. Sometimes you're dealing with different size legs here. So make a habit of always using your forearm. So I just kind of scoop my forearm under and lift it up even more if they need a further stretch. Sometimes just scooting your leg in further will help give them a bigger stretch. Okay. So it's probably been 15 seconds for her. So now I bring the leg back. I use my hand to catch her thigh here, and I lower it carefully. Or you can even just grab it like this and lower it carefully. Sometimes I deal with athletes that tend to be quite large, and muscular wise, and they're too heavy for me to do all this stuff. So I just do what I can. So lowering the leg like that is perfectly fine. So to stretch the glutes, this I don't stretch the glutes to the point where she tells me to stop. I just do it to the end feel that I feel. So I start out with her leg in. I find that greater trochanter, and I roll off of it medially. So right there, I'm at the attachment points of the glutes, and I bring the leg back towards me, stretching those attachment points. And now I find the sacrum, roll off the sacrum laterally. Now I'm on the muscle, on those attachment points. I'm not applying a lot of pressure right now. I'm just bringing the leg in. Now I'm applying my pressure. Bring the leg out, giving that glute a nice stretch. Relaxing the wrist. Now I'm going to stretch the TFL. So I'm going to go down to the TFL. I'm just kind of in the belly of the muscle. Bring the leg in, apply pressure, bring that out. It doesn't give a great stretch to the TFL, but it does give it a good one. So, all right, so we're done with those stretches. Now we're going to work the gastrocs and then the hams. If you're running out of time, you can skip the gastrocs for the first treatment. I'm going to go ahead and show you now, though. And then you can work then the second treatment, because the second treatment should go a lot quicker for the other stuff. Sometimes the glutes will take longer on the first time around. But the gastrocs are really important to release. They have everything to do with what's going on in the hips. So, using my canola oil, I'm getting lots of lubrication here, and I'm gonna go ahead and get right around that greater trochanter because we're gonna do more work there. Okay. So typically people with low back pain have a very, there's like a band that comes down right here, and it's so tight it often feels like a bone. She doesn't have that. Well, she's got a little bit right there. So what I do is not with the very point of my elbow, but on more of the flatter part, I get that on that tight spot. But I'm using the rest of my arm to apply pressure here as well. So I'm not just digging in. This is extremely painful for people. So just have some empathy, but tough love as well, and get in there and get that to release. It's good enough if it releases even 10%. We just want even just the smallest change. And it can take a few massages before it fully releases. And I mean a few, I mean a lot. So, but some people release after 2 or 3, some people it takes 10. I would normally go a lot slower for somebody who has that issue. Leah does not. So I'm going at the speed that her muscle's allowing me. And but I think she's got a little bit of tightness going on in there. So I'm going to go to the belly of the muscle. You'll find all sorts of problems in these little guys that the client has no idea is even in there until you're on it. But you'll find that once you get everything in the gastroc and soleus area healthy, their low back pain disappears and it won't come back. This is critical. But it can take the longest to get healthy, because it probably started here a long time ago. And then all their problems worked its way up. So I'm just following the tension, and it led me right back up to that spot. So, okay. So now I'm going to work the hams. I'm usually running out of time at this point, so I don't want to spend too much time on here. I just want to open it up just enough to where by next treatment it will have healed a little bit. So me personally, with my coordination skills, I like to start off with my right arm on the hamstrings and work my way up with my hips facing the table, leaning on the table, and everything as straight as it can be, shoulders locked. And I'm just at the depth where the hamstrings are pushing back. And as I reach the top, it tends to get really tight right in here for somebody with low back issues. And this is where it gets really painful for them. But don't let up unless they tell you to. You've got to keep that pressure in there. And it's going to start to fight you in this area. You want to maintain a really deep pressure. In fact, sometimes I'll just go deeper. You want to go all the way up to that ischial tuberosity. I can feel the muscles giving in. She doesn't have as bad of issues as some people do. You'll feel it get thicker. That's the best way I can describe it. In this area, it gets dense and thick, and it fights back. And you just want to fight your way through it. Okay, so I'm up at the ischial tuberosity. I'm right on top of it right now. I don't want to be digging into the bone. That's really important. I'm just off of it. And now I'm kind of sliding laterally. There's some tightness there. I'm mainly palpating at this point, although it is releasing pressure too. You'll see the ischemia right here. That's where that density tends to be, and so you can see it. So now I'm going to work right around the greater trochanter. This is a great way to really get into that joint, especially for people who complain of bursitis. They think they might have arthritis. Not that they've been diagnosed, but they come in saying, oh, it feels like arthritis here. This clears that up. So I'm going to kind of start with her leg in a little bit, but not as much as I did before. It's just kind of right about there. And I'm not going very deep. I'm kind of at just a level where I can feel it start to get tight. And then as soon as I feel it get tight, I'm using this to wriggle, move that bone around. Because I'm next to the bone. And this is kind of wriggling my way in. And you'll know what I'm talking about when you actually do this. You're opening that joint up, and you want to be deep in that joint as far as you can get between that greater trochanter and the pelvis. So now I've got her opened up in there. The leg is out. The greater trochanter is rolled laterally. And you can often feel tightness, density, ropes. You know, the muscle tissue feels like ropes in there, cables. And you just want to keep moving that bone around, keep the elbow right in there. I'm using the point of my elbow and work my way up around the greater trochanter. Using the foot to kind of help keep things moving around, wriggling my way in. Make sure your shoulder is locked. This is where you can start to cause damage if you don't do this right. Damage to yourself. Okay, so the goal is to get to the top of the greater trochanter and roll the leg back this way and roll your elbow all the way up around the top, down this way. Not that fast. I just wanted to do that for demonstration purposes. I only do it as fast as the tissue will let me. So the elbow is right in the ditch, basically. You can feel it. I'm moving the bone back and forth, and I can feel the bone moving under my pressure. So I go all the way up. As soon as you get to the top of the greater trochanter, you go in, and the bone will just move around and under your finger. That's what I'm doing. Okay, so now we'll do the other side, starting with the stretches. So Leah, tell me when to stop with each stretch. And do an adductor stretch. Cradling the knee with my right hand, cradling the ankle with my left. Okay, now we'll count to 15. Also make sure that you're not holding her leg up and tensing your shoulders up. You want to just let your arms be long and let it just hang. Everything is hanging. You're not using a lot of effort here. A lot of people want to do this. You want to make it easy for yourself. Okay, bring it back. And now I'm just going to bring it on up to on my thigh. Tell me when to stop. You can also get a further stretch by doing this and giving him a nice gastroc stretch. But make sure your hips are facing her. Okay. And now I'm going to go ahead and lower her leg like that so you can see both ways. Now we're going to do a glute stretch. So I'm on the greater trochanter, rolling medially off of it. Now I'm going to bring the leg out, just giving that a nice stretch. Make sure your shoulder is locked, your wrist is relaxed. Off the sacrum, right onto the insertion or the origins here of the glutes. Now the TFL, right on the side here. I like to do a deep lunge here to get deep into that side so I'm not tweaking my back. Bring that back. Make sure your shoulder is nice and locked into position. Okay, now we're done with the stretches. We'll do the gastrocs and the hams.